I first want to say thank you for being given the opportunity to share with you today. Jackson County is a little rural Appalachian county located on the western side of West Virginia. We border the state of Ohio, and we have 29,000 residents. And our coalition got its start because we had 16 kids die from 2006 to 2008 directly related to prescription drug abuse. In 2005, our youth were using OxyContin twice as much as youth across the nation. And in 2007, 2008, OxyContin use shifted to the use of fentanyl patches, and that's what killed most of our 16 youth. By 2009, our prescription drug abuse rates among 12th graders were holding steady at almost 8%, using in the last 30 days. And our coalition began working feverishly to educate not only our youth, but the seniors and the general public on the dangers of prescription drug abuse. And so by 2013, Monitoring the Future data showed a 10.3% decrease in 12th grade monthly use of prescription drugs, while Jackson County was showing a 17.7% decrease in prescription drug use among our youth. And 12th grade use annually among the students who were surveyed through the PRIDE survey, which is a national survey that's done, our 12th graders were using less than the national average among those who were surveyed with PRIDE survey. And prevention science tells us, you've heard already, that as risk and harm increases, usage decreases. And so our 2013 PRIDE survey showed us that what we had been doing since 2009, we had the highest perception of harm among prescription drugs versus tobacco, alcohol, and marijuana. And so for us, we knew what we were doing in our community was the right thing. And as a result of the increased perception of risk and harm, we saw a decrease in the number of overdoses that were tracked each month. And part of that was because of everything that we had been doing the past 4 years to educate the community on prescription drug abuse. We saw a decrease in those overdoses. We track that monthly with our local emergency management services. So through a small federal investment of Drug-Free Communities grant funding, our coalition has been able to leverage local community resources and volunteers to make a pivotal community change. Through training at CADCO Academy, our coalition learned to identify root causes and local conditions specific to our community, therefore leading to successful strategic activities resulting in positive change. Our coalition has been able to provide support and advocate for access to the state prescription drug database, as well as advocate for mandatory use of that database. We've been able to enhance skills of our youth and our educators, working with them each and every day. In addition, policies have been changed, making youth usage and availability more difficult for our kids during the school day, because that was one of the reports that we were getting, was that our students were using in the middle of a classroom and teachers had no idea. Our coalition has provided our community with the education and support to know the kind and giving nature of the Appalachian residents is not a good thing to have in regards to prescription drug abuse. With a number of collaborative partners, our coalition has diligently provided educational programs and information regarding the dangers of the sharing culture that we have when it comes to prescription drugs. We have worked tirelessly with the Department of Environmental Protection to ensure that our residents can protect their homes from danger through the placement of permanent drop boxes and education on proper disposal. We have collected in the last 5 years over 400,000 pills. We don't use poundage because poundage doesn't tell us a whole lot, especially when you're weighing the packaging. We actually count each individual pill and log what it is that we're taking in. We have successfully advocated for statewide destruction of collected medication, as well as assisted in the development of statewide protocols for collection and destruction of medication. Providing Jackson County residents the ability to dispose of medication, in addition to the information and knowledge they need to protect themselves, their children, and their grandchildren, have enabled our community to change the tide. Jackson County has had no youth overdose deaths since 2010 among our youth. And due to the small federal investment into our local community, we are saving lives each and every day, and for that, our Jackson County residents are eternally grateful. Thank you.